Hello, today we'll look at Galvus. Galvus is the trade name of Vildagliptin. As we know, we are talking about DPP4 inhibitors, and the group of DPP4 inhibitors contain different type of molecules called VALS. We have VALSS. We have Vildagliptin, allogliptin, we have linagliptin, we have sitagliptin and saxagliptin. Today we're looking at Vildagliptin and the trade name, meaning the company gave this substance a name, and that will be Galvus. Galvus can be given 50 milligram, usually 2 times daily. That is 100 milligram per day. And usually it is given as monotherapy or together with metformin, for example, or thiazolidinedione or sulfonylurea. This can be the combinations. And actually, Galvus can also be given as a triple therapy. That meaning we have then Galvus together with metformin and insulin, or metformin and sulfonylurea. So this is a triple therapy. And the dose can be, for example, as we said, then when we combine Galvus with metformin with 50 milligram, one in the morning, one in the evening, and if we combine it with thiazolidine, also the same. But if we combine it with sulfonylurea, we need to give only 50 milligram once daily in the morning time. That's the difference only with sulfonylurea. And the other difference is also if we have a very severe kidney insufficiency, let's say less than equal to or less than 45 milliliter per minute of GFR. GFR is the flow through the kidney, and if we have lower than that, we need to give 50 milligram once daily. It's the same as with sulfonylurea. Otherwise, it's 2 times daily. Now, what type of side effects do we have of this molecule? We are talking about Vildagliptin, and this can have many general side effects like headache, like nausea, dizziness, tremor. We can have angioedema or peripheral edema. We can also have things like nasopharyngitis, also acute pancreatitis. Even liver enzymes can be increased, there can be obstipation, and so on. So there are many different type of side effects that can happen. And therefore, we have some contraindications of this medication. The contraindication would be, for example, that we have type 1 diabetes. This is not allowed. You're not allowed to give Galvus to a type 1 diabetes. Therefore, it's very important that you distinguish type 1 and type 2 diabetes. That is one contraindication. The other contraindication would be, for example, as we said, acute pancreatitis. That is also a side effect to it. So it means that if you already had that in your history, then please don't start the DPP4 inhibitor, for example, Vildagliptin, because that can worsen the acute pancreatitis. Also, we have severe heart insufficiency, severe kidney insufficiency, severe liver insufficiency. These are all contraindications of giving Galvus, so giving Vildagliptin. The liver enzymes, if they are, for example, elevated more than 3 times the upper limit, then please don't give this Vildagliptin. So I think that is enough. You don't need to know more about these type of medications, because the most important is that you remember the trade name, you remember the doses, you remember some side effects, and you remember then some contraindications. So thank you very much for listening. Bye bye.